Isaiah.
So how old are you?
I'm 20 years old.
So today, I will introduce myself already that my name is Folashade Onosanya. I will be performing physical examination on you today. So, do you want to use bathroom?
No.
Is everything comfortable for you?
No.
Do you want to drink anything?
No.
Okay. So thank you, Miss Mary. So first of all, the skin is exposed. You can see, and I'm inspecting it. On the face, it has some scatter hacking. It's due to the age. It's normal to the teenager. It's 20 years old. So, and now I'm going to feel for the texture, the color, if it is mold or dry skin. But Miss Mary's skin is warm to touch and it's moist. There's no dryness. And here, from the right hand, right forearm, I can see some birthmark. And the birthmark, I'm measuring it, is about 2 centimeters long and 1.5 centimeters in diameter. So I want to check for the tuggle of the skin. I want to see the elasticity. I want to see for dehydration. So the best skin area that is good for to check this is abdominal skin. So it's the skin is firm. There's no loose. It doesn't lose the elasticity. So it's firm. You can see the skin to God is okay. So can I look at your back? So I'm inspecting the back. The skin at the back is okay. There is no rashes. There is no lesion. Miss Mary, have you ever had any surgery before?
No.
Do you have any operation, any skin condition like cancer, chickenpox, or any of that before?
No.
Have you ever do any surgery?
No.
Do you have any wound anywhere?
No.
So I'm moving to the legs. On the legs, in the nail area, there is it's more darker than the other body because of the ethnicity, because it's a black America. So and I see some scatter scar due to the previous abrasion and bruises. So that is what I can see. The feet, they are moist. There's no dryness. Everything looks good to me, and the the texture is okay. The skin too is firm, and there's no loosening skin. There's no sign of infection in the skin. So it's neat. Miss Mary is looking well kept. So that is all for the skin assessment. So I'm going to move on to the hair. Can you stand up for me, Miss Mary? So in the hair, what am I looking for? I want to look at the distribution, the texture of the hair, and if there's any infestation of lice. So I'm looking at it now, I'm inspecting it, but I'm still going to palpate it because I need to inspect it more deeper inside. So there is no, it's neat, it's well distributed. There's no loss of hair, there's no alopecia, and there's no lesion as I'm looking at it. Do you have any surgery on your hair before?
No.
Do you have any lesion or any wound?
No.
Any depression of the skull?
No.
So there's no depression of the bone. Everything is intact. So and the hair texture is good, and there's no breakage. There's no some hair where you pull it, it can easily break. So it's firm, attached to the skin of the skull, and there's no infestation of lice or any dandruff, and there's no flake, and no previous surgical operation in between the scalp. There's no lump. There's no purple lump. So that is it for the hair, and let me feel the temporal pulse. So it's regular and firm, you can see, and bilaterally they are all okay. So now, do you have any questions so far concerning your hair?
No.
So how often do you wash your hair, Miss Mary?
Every 2 weeks or twice
Okay.
a month.
Okay, so Miss Mary, because the plate also wash the hair twice in a month, every 2 weeks. So we are moving on to the nail. So what am I looking for in the nail? I'm looking for the texture, I'm looking for the nail angle, if there's any clubbing, and I'm looking for the thickness of smoothness and the length, if they are firm, if there's any ingrowth. So now I'm inspecting Mrs. Mary nail. Can show the two hand at the same time. So it's pink and good capillary refill. So and the nail I'm palpating it, they are well attached to the skin, and there's no loose, it's very smooth. So and there is a little bit birthmark here, just like it's not even up to anything, so just like a point. So to the same right hand, so at the knuckles of there's a birthmark there. So there's no clubbing nail, and it's neat, and the length is okay. There's no ingrown nail, there's no loose, there's no thickness. So there's no nail infection. The color is pink, and there's no blood bleeding under the nail. There's no bleeding issue under the nail, and there's no discoloration. So everything is good, it's firm, it's not thick, and it's adhere to the nail bed. So we're talking about the nail base angle. Nail base angle of Miss Mary, I'm measuring it. It's within 160 degree, and any nail angle that is beyond 160 degree or above 180 degree is a clubbing foot, and this present in the COPD patient, the patient with the lungs problem. So but Miss Mary nail angle is 160 degree. So in old adults, their nail can be so thick, but Miss Mary nail is very firm and smooth. There's no thickness. So with a good capillary refill. So there's no problem with our nail. Everything is I've prepared the nail plate. There's no for the texture, fitness, and thickness, and hydration. So everything looks good. So thank you, Miss Mary. I've finished with that. And do you have any question?
No.
So now we are moving to the major part of the examination. We are going to the eyes. I'm going to check the visual acuity, and I'm going to observe for some cranial nerves, and I'm going to check the nose. I'm going to check the ear for if there's any deafness, and I'm going to check the patient for any throat infection. So and I have my instrument here. I have my chart. I have my tongue depressor. I have my horoscope, and I have my patella hammer. I still have my ruler in case if there's anything. So and I have everything. So first of all, we start with the eyes examination first. So I'm going to start inspecting the eyes. Miss Mary, I want you to look up. I'm looking at the sclera is very clear, white. There's no blood stain. There's no sign of infection. There's no jaundice. There's no redness. And Miss Mary, do you have any eyes problem?
No.
Do you have any surgery before in your eyes?
No.
Have you ever visited ophthalmology?
No.
Uh-huh. Do you have any uh, double vision before?
No.
You don't have problem in seeing. You
No.
can see anything.
No.
So I'm going to check further for that. That is a subjective uh, assessment. So I'm going to look at the objective one to see what is going on. So I'm checking the conjunctiva. It's pink. There's no blood stain. It's not pale. Some can be anemic, but Miss Mary has very pink conjunctiva. There's no issue with it. Look up again. You can see Miss Mary is looking up. Then can you roll your eyes from one angle to another? So you're going to follow this. Um, you're looking at it. You follow it. Don't move your head this way. How about this way? Down. Okay. So, and again, I'm going to let Miss Mary read and see if it can read and to check the accuracy of the, and I'm going to save about 6 feet away so that it can read the chart. So Miss Mary, can you read the first letter?
E.
You have to cover your eyes.
E.
Then the second line.
LT.
Mm-hmm.
FFH.
Okay.
DLCF.
Okay. Can you read the last letter?
ITF.
Mm-hmm.
FH.
Okay. So cover the other and do the same thing for the first, second, and the last.
ELT.
Mm-hmm.
ITF. EH.
Again, don't press your eyes too much. The last letter.
ITFFH.
Okay. The visual accuracy is okay. So it's 2020. The last one is 2020. So Miss Mary is good with that. So I'm gonna look deep into the eyes. I'm gonna check for the pupil. I'm gonna use my paint touch and check. You can see the paint touch too has some. So now, Miss Mary, you look straight into the light. So let me not block the video. So the pupil reacted by constriction. I'm going to share the other pupil too react to the light, and the eyes, they are symmetrical. They are equal to the online bilaterally. So there's no problem with the vision, and they are uniform in lining. So, and everything looks good to me. There's no lesion there, because some patient can have it grow uh in the lesion, or some lump in their eye slit. There's no lesion, there's no lump, and there's no jaundice. There's no redness, there's no sign of infection, and I can see clearly. The I'm going to look so deep at the back of the eyes. Can you open wide? So everything looks clear. There are good blood supply. There is no issue with anything. So everything concerning the eyes is okay. So, and lastly, I'm going to share for the eyes. I'm going to share the peripheral vision to see the cranial nerves if they are intact. So now, can you, any hand that move, can you point to it? You just look straight to me. While you are doing it, you don't look down. Then, okay. So Miss Mary is good. So that is the end of eyes examination. So we are moving from the eyes to the hair. So what am I looking for in the hair? I want to check if there's any hair infection. I want to look at the tympanic, and I want to see if it is infected or not. I want to see if there's any discharge, if there's any obstruction, and if there's any ingrowth inside the hair. So first of all, let me ask Miss Mary. Miss Mary, do you have any hair problem?
No.
Do you have problem in hearing?
No.
Can you hear me?
Yes.
Can you hear me
Yes.
equally? When I say something, can you just tell me what I say?
99. 44.
Okay, Miss Mary can hear that. So now, I look at I'm inspecting for the eye here. It's uniform. There's no low set here like Down syndrome, but they are equal at the same level. So they are equal at the same length, and they are symmetrical bilaterally. So there's no disuniformity, and the tension is okay. There's no swelling. Palpate, there is no lump. Palpate the other two, there is no lump too. So everything looks good. So we're going to check for the auditory now. So Miss Mary, you're going to tell me if you hear the vibration.
Yes. Yes. Yes.
Do you hear it both sides at equal level?
Yes.
Okay, so Miss Mary can hear good. Um, so I'm going to use my horoscope to look into the hair. Okay. So Miss Mary, this is it's just a little bit, it's warm, so it's not going to hurt you much. So I'm going to pull up its adult and backward so that I can see. Oh no. There's no wax, and let me look at the tympanic. The tympanic is gray. There's no sign of inflammation. Hmm. There's no wax. There's no redness. The hair is patent. I can see very far, far, far. So now I'm going to clean so that I can go to the other here. So up and backward. Yeah, it's gray. There's no sign of inflammation in the tympanic membrane. There's no wax, and there is no lesion. There's no growth inside. There's no sign of infection. Everything looks good to me. Miss Mary, that is good. uh, so so now we're moving to your nose. Do you have any questions so far, Miss Mary?
No.
Nothing touch. Okay. Okay. In the nose, what am I looking for? I'm checking its well shape. There's no disformity because some growth can deform nose. It's well fit to the middle of the both eyes. It's good. And the can you block your can you breathe good?
Yes.
Block the second one. Can you bleed good?
Yes.
So there's no obstruction. So, and I'm palpating it if there's any growth inside, if there's any lump. There's no lump. So now, and the skin is moist, and there's no injury to the nose. So do you ever have any problem with your nose before?
No.
Any surgery?
No.
Any obstruction?
No.
So you don't have any cold discharge and nothing.
No.
So I'm going to be looking into the nose and see if there's any obstruction, if there's any lesion, if there's any discoloration. That is what I'm looking for. So now, so can you raise your head? So the nose is painted, there's no deformity, there's no discharge, and no discharge. There's a little bit some here, but it's normal. Just it has as a barrier to protect any dust going to the uh, nose. So there's no mucus, no discharge, no polyps, nasal polyps. There's no obstruction. The nasal orifice is very painted. Do you have problem with smelling? Smelling abnormally?
No.
So there's no discharge, there's no sign of cold, there's no drainage, there's no discharge, there's no pus. Everything is painted, there's no growth inside. So the nose is good. They are pink inside, and the skin is intact. So we're moving to the last one. So before I do that, I need to perform my hygiene and wear my glove. Okay, I have my spatula here, and I still need my touch too to look into the. Miss Mary, can you smile for me? Can you frown? Can you blow? Okay. Can you move your tongue up and down? No. This way, this way. Okay. There's no restriction, and the cranial nerves is very intact. So can you open your mouth widely? The lips is pink and it's moist, and the tongue is pink too. There is no ingrowth lesion, and the teeth is they are well set, and there is no ingrowth teeth. There's no gingivitis. There's no redness. There's no sign of gum infection. So I can see. So the soft palate and the hard palate, they are intact, and there's no any sign of gum infection. So the tongue is okay too. Um, I'm going to look at the glossy tonsil to see if there's any tonsillitis. So Miss Mary, you can going to open wide and let your tongue come out, and you say ha. Wait, I'm going to do it together with the torchlight. Okay, say ha. So there's no sign of infection. Everything looks good. I look at the back of the throat. There's no redness. There's no inflammation. There's no growth, and there's no pus. It's pink. There's no greenish discoloration. Everything looks good. So, do you have any question today, Miss Mary?
No.
Do you have anything to ask me?
No.
There is no problem. So, in the absence of no problem, let me take my glove off, and I want to say thank you for watching, and have a wonderful day.